Okay, now we've got the patient down on the table after doing the preliminary stuff, looking for lower limb tension signs, looking for any segmental weaknesses. We've checked that we have 2 positive signs. The right SI joint seems to be hypomobile in the standing forward bend test and in the stork test. Now what we're going to do, as long as I get the patient down now, I can test a number of things. And what I always try to do, if your table has a crack in it, a separation in the table, try to get the patient's butt up above that. First thing I do is have them bend their knees. Good. Have them raise their hips up in the air so they clear the table, then set it down. Then what I do is draw the legs out like this. Okay, and I come down here and I look to see if we've got a level symmetrical platform to stand on, and as you can see, her right leg is much longer than her left leg. What I am is under the medial malleolus, and they do not look nice and level to me. Okay, they're off. So I now come back up here, move the patient's hands out of the way, I bring the top up a little, I pull this down, and I want to get on the anterior superior iliac spines. Okay, she looks pretty level here. I say, okay, so we're not having a problem here. I'm underneath the spines pushing up, and with my dominant eye in the center, I don't see a rotational issue. I then want to go for the pubic bone and come down with the heel of my hand, find out where the pubic bone is, and I find out that she's got a big asymmetry here where her right pubic bone is actually depressed. So again, all on the right so far. I can do a squish test from here where I come over here and I squish in on each bone, find out which bone's given and which bone is not given, okay? And then I'll have the person flip over onto their stomach for me. Now, it's always good to have their feet off at the end of the table, so I pull them down so the feet are comfortable. I then look up here at the gluteal fold. I find the gluteal fold, I go in at a 45-degree angle and push up, in at a 45-degree angle and push up, and I notice that my right thumb is buried. It doesn't have a lot of daylight on it compared to the left thumb. All right, so what I then want to do is say, all right, if I know my right side is hypo, again, 3 out of 3 tests so far show that the right side is hypo, and so she must be upslipped because I got a buried thumb. I will just do my tug test finally, finger in the SI joint, tugging up and down. Switch sides, tug up and down. In effect, the right side is the hypomobile side. Once I've taken a look at the pelvis, I then come up and appreciate the ILAs, the sacral ILAs. They look good. And I follow that up into the sacral sulcus. And I come in for the PSIS in a centimeter, up a centimeter. I stick my fingers in to find out if there's symmetry, and her sacrum is actually quite symmetrical. I then come up into the lumbar spine and get on the spinous processes, looking for an asymmetry, and then have the patient come up on their elbows and rest their chin in their hands like they're watching television. And then I find that, in fact, right here we do have an asymmetry, and if you've taken the course or you know arthrokinematics, you know that since she's sticking backwards on the right, this is a flexed, rotated, and side bent to the right. This concludes the evaluative part that I do basically for a lumbar spine on down into the hips and the lower extremity. There's more to do. Obviously, I would probably take a look at her hip joints to see if there's any pathology in the hips. But basically, for the part of the M1 course, that was the basic evaluation that I've told you about.